children start school with unmet vision, hearing, or oral health needs, that can manifest itself in many different ways. It might look like a behavior issue or an attention issue, or the child might have difficulty learning how to read or learning how to converse with others. So if we can get ahead of that, if we can identify those needs and provide the appropriate services, that can ensure that kids are able to learn and enter school prepared to succeed.
Yo había llevado a mis hijos a sus chequeos de su chequeo físico, pero el doctor solamente les había hecho un chequeo sencillo. Yo no sabía que ellos iban a usar lentes, y gracias a la Fundación de Niños Saludables, cuando los fueron a evaluar a la escuela, fue por lo que supe que ellos necesitaban sus lentes y que debían llevar como a un tratamiento. Ellos también me ayudaron para poder localizar al oculista adecuado y con el que ellos se sintieran cómodos.
Health and education are combined. They're integrated. They're never separate. You cannot have optimal learning if you're not feeling well. That's why the significance of screening is important. Children are just learning language. They may not have that life experience to say, I see blurry, I don't hear what you're saying, or my mouth is hurting. And so having the early screening gives us a window into what we need to do for intervention.
Healthier Kids Foundation mission is to make sure all children get the preventive care they need so that they can thrive in the educational setting. That's really what it's all about, being healthy, happy, and being able to thrive in education.
With the case management team, we speak with families directly, and we have learned that there are many barriers that families come across. For example, many of our families are single parents, or they may work 2 jobs. They don't have the availability, they don't have the resources, including language, insurance, lack of knowing what insurance covers, where to go, embarrassment. Some families may be in denial that their kids may need glasses because they don't want their child to be called 4 eyes, or they don't want to take them into the dentist because they don't want to acknowledge that their child is in pain or has severe cavities. And our job is to break down these barriers and to reach as many kids as possible in the Santa Clara County.
The screenings do take place in elementary schools, middle schools, preschools, and daycares, as well as some community events. The process of screening a child, if we do all 3 programs at the same time, it can be done within 5 minutes per child. For the dental screenings, we hire licensed dentists who conduct the visual screening. For vision, we use a vision camera. It's very simple. It takes about 30 seconds per child. For the hearing screenings, we use hearing screener devices. Once the screening is complete, we will know whether this child has passed the screening or will need follow-up care.
Often screenings are completed, it goes home in a backpack, it sits there. The strength of what we do is what I call high touch, high tech.
If a child is found to have a condition, those results are trickled down to the case management team. We provide follow-up care, we discuss the results, recommendations, and resources to our families. We come from this community. We know the resources that are available there. We grew up in this neighborhood. We know the languages. We speak English, Spanish, Vietnamese, Chinese, and we build rapport, we build a connection, we build a relationship with these parents to ensure our kids get the health services that they rightfully deserve.
A common question that parents ask us is it too early for my child to be screened? And I say to them, it is too late. We want to screen children at an early age for the purpose of getting it early so that when they eventually get to school or as they're learning, we want to equip them with the tools that they can learn. Having the child simply just focus on learning without having to worry about falling behind or anything like that.
Yo les diría a las otras familias que es muy importante que les hagan a los niños este tipo de evaluaciones, porque así nos daremos cuenta si ellos tienen alguna condición dental o de la vista.